feeling of lack of or loss of control. And that's when the body starts to feel those arousal symptoms.
Those are so common. Thank you to the caller for calling in. And we got to take a quick break. I mean, that was a loaded question. And we can go on and on. I love this topic. When we come back, we will talk to Dr. Levine about some lesser-known phobias and treatments and what you need to know. Plus, we have another special caller. You're watching the Health Channel on South Florida PBS. Don't forget to give us a call if you'd like to ask the doctor a question. The toll-free is 855-796-4475. At our website, allhealthtv.com, and follow us on social media at allhealthtv. We'll be right back.
Wonder if you should get tested for colorectal cancer?
Is it really that common?
It is. It's the second leading cancer killer in the U.S.
I don't have symptoms.
It doesn't always cause symptoms, especially early on. And screening helps prevent the disease.
Oh? How?
By finding precancerous polyps so they can be removed.
But that test...
There's more than one screening test. If you're 50 or older, talk to your doctor about which one is right for you. Colorectal cancer screening really does save lives.
Did you know that people born from 1945 through 1965 have the highest rates of hepatitis C, but most don't know they're infected? People can live for decades without symptoms, but over time, hepatitis C can cause serious health problems. If you were born during these years, the CDC now recommends that you get a blood test for hepatitis C. So talk to your doctor and find out if you have hepatitis C. It could save your life. No more.
Many websites selling medication may look professional and legitimate, but the vast majority of sites selling prescription drugs are doing so illegally. Criminals use websites to sell counterfeit medications that may contain life-threatening toxins. Dot Pharmacy is a website verification program that helps you identify safe and trustworthy online pharmacies. Purchasing medicine online can be safe and easy. Just look for pharmacy to the right of the dot in website addresses.
And with me is Dr. Paula Levine, a psychologist and director of the Miami Counseling Resource Center. If you have a question for the doctor, give us a call. The toll-free number is 855-796-4475. And Dr. Levine, I want to jump right into Cherry, who's on the phone. She is one of your former patients, and again, another wonderful story. Cherry, are you there?
I am right here.
Oh, thank you so much for joining us and for your patience. I know that you've been dealing with agoraphobia for decades now, and I want to know, how did you know that you had this phobia, and how did it begin?
Well, what happened was it was probably in the 70s, early 70s, and I was smoking pot then, and I had a really bad experience, and so my parents thought maybe it was laced with something, and I stopped doing everything. But I kept getting what they were calling flashbacks. So for years, I thought it was flashbacks from this experience. And my mother, so I got it at 14, had it for 47 years. My mother read an article when I was about 21, because I had stopped driving, couldn't go out of the house, couldn't go to my mailbox.
Wow.
It is fear of fear. It's not fear of anything specific. It's fear of the anticipation that I'm going to go into panic mode. It makes you feel like things aren't real. it's so irrational, it's hard to describe.
No, I understand.
Yeah. And so my mom read a very tiny article, and I can't remember where, and it was about Paula Levine, Dr. Paula Levine. She was working in the Grove then, and it was a cutting edge time. No one had really talked about agoraphobia, and my mother said, "You're going." So I got in a taxi because I couldn't drive, and I went. And the moment I walked in, I saw other people that were talking about the same things that I was.
Wow.
And met a woman who hadn't left her house in 10 years. It was mostly women. There was one man in the group, if I remember correctly. But I felt relieved that there was a name for it. I felt at that time Dr. Levine was teaching us skills to deal with the anticipation, and it came on strong for me. So skills like diverting my attention, carrying a bag of peanuts. I mean, it was really cutting edge. So this was all very new to a lot of us on how to really deal with that. And not many people knew what agoraphobia was. They would say agoraphobia, and no, that's fear of being sexually assaulted. But it's agora, as Paula said, Dr. Levine said.
Let me interrupt you there, Cherry, really quick, because I want to ask Dr. Levine, when you worked with Cherry in this kind of, as she said, it was a kind of a breakthrough way to deal with agoraphobia. What was that process like, especially with Cherry?
Well, we did group work, as you can hear. And honestly, Cherry, correct me if I'm wrong, my treatment approach and the combination of techniques, even though I've honed them and there's so much more literature now, we didn't talk about the amygdala back in the 70s.
No.
Right? Or the prefrontal cortex,
Right.
and we think in a different place than we have panic. But body, mind, behavior. I did relaxation exercises, right, Cherry? The deep breathing. We did 20, 30 minutes every session. This is long before mindfulness meditation.
Right.
And last week we talked about how meditation in some ways is taking the place of the deep breathing, because it's all about the breath. We have to
Right.
return to the breath to get centered. So we did the body focus. We did all the CBT, the cognitive work for the mind, you know, how irrational the fears are, how likely, how probable, what's the evidence that what it is you fear will actually occur, to get people to say, well, it's probably not ever going to occur. It's all in my mind. I'm telling myself stories over and over and over again of the things that I fear that are interfering with my life that are probably not going to happen. That's the cognitive piece. And the behavioral piece is get out there and do the work. You have to expose yourself to the feared situation by going into it.
Cherry, how has your life changed right after seeking treatment and doing this kind of therapy? Do you feel like you've overcome your phobia, or you've made strides in your phobia?
I have made great strides. Paula, Dr. Levine, she's Paula to me. Dr. Levine has been in my heart and in my pocket, in my spirit for 40 years. I lost touch with her after we moved, and I can't remember how long we were. I went to see her in the Grove back then. I do remember we did a lot of breathing, and now I meditate a lot, so that has helped. Afterward, when I lost contact with her, I can't remember why. My life really, I knew what I had, and so I knew what I had to do, and I had a certain set of skills that Paula ran us through and taught us, but I still couldn't drive on the expressway. I couldn't cross a bridge, and I would get attacks that would come on. They would just come on. There was no warning. You anticipate it constantly.
That's the amygdala.
And I just kept thinking of divert myself, breathe, divert. But when you're in that state, it's so difficult to do that. So through the years, I just have been trying to face it as best I can. I've met a few therapists that sort of know what it is, but not many.
Not like
I've
Paula
met that
Levine.
do. No, there's no one. There's no one like Dr. Levine. And when I found her again, maybe a month ago, it was like finding the person who saved my life again. And she really did. She gave it a name, and I knew I wasn't crazy. And now I know a lot of people do have it. And I live with it. I don't have the anticipation. Sometimes when I'm driving on the expressway or a suspension bridge.
So you got back in that car, Cherry. You got back in that car.
Oh, I had to. You know, well, actually, I broke up with somebody I was living with who kind of enabled me, did everything for me. When we broke up, I had to drive.
Good.
But I still got panic attacks. I still went into agoraphobic state. It's very hard to describe.
But you do drive, Cherry, do you drive on expressways now?
I drive on expressways. I drive from North Carolina to Florida. I went to Charleston a few times and went over the suspension bridge, which to an agoraphobic is probably suspension bridge.
Right.
And I went over it by mistake, took the wrong exit, so I had to cross back over it, and I did it maybe 4 or 5 times.
I call that progress, Cherry.
It was huge, but Paula was there next to me in the car. I mean, I have to really stress that, you know, meeting her when I did in my early 20s, and what we were learning then and what her knowledge of this then, I've carried with me and used with every situation that I have had to face. I have met a doctor probably in my late 40s that put me on tried a few medications that did not work for me, and I am on one now that's working, but I'm doing so much meditation now that sometimes I forget to even take my medication. So that's a good thing.
That's a good thing. And Cherry, thank you so much for calling in and for sharing your story. I wish you so much luck and success. Thank you again.
Call me.
I will call you.
When you come to Florida, you promised.
Okay, so before I wrap up, I do definitely want to talk about treatment. Treatment, so
next
once
week.
the diagnosis happens, what's the treatment like?
That's the treatment. I mean, I don't want to oversimplify it. We know so much now. I didn't know about neuroplasticity in the 70s and the 80s. That's the brain's ability to change. I used to preach you can change the way you think. You can do positive affirmations. We can turn negative anticipatory thinking catastrophizing. They predict the worst. So someone said something about demystifying. I work on decatastrophizing. If my patients can do something, even with a little bit of anxiety, but not the full-blown panic attack, and come out of it and say these 3 words, no big deal. NBD, those are my favorite words, no big deal.
NBD.
I know they're over the hump.
Okay, we're out of time, and that means that next week you got to come and talk about treatment. So that does it for us at this hour on the Health Channel. Make sure to follow us on social media at All Health TV, and also visit our website, allhealthtv.com. Thank you.
Us lives here, where we can be surprised by others and ourselves. For a better us, support your local Y today.
It is the most amazing gift that you can give someone. Seeing individuals have an opportunity with their lives that they would never have again.
Make-A-Wish grants a wish every 17 minutes. I know that sounds pretty magical, but in fact, it takes more than magic. It takes muscle.
So, when a kid like Fabian wishes to be a superstar, things happen. Whoa! Or when Kahim transforms into Super Kahim.
He feels invincible. It's because wishes have proven physical and emotional benefits that can give children with critical illnesses a higher chance of survival.
Help us make sure every wish comes true. Join us at wish.org.
Don't just worry about your health problem. Ask an expert. An answer to your health question is as close as your phone. Call 855-796-4475. The Health Channel, America's first all-health, all-the-time TV channel. Fully qualified health experts, doctors, specialists can answer your health questions. The Health Channel, all health, all the time. Call 855-796-4475.
Welcome to the Health Channel, all health, all the time. I'm Kathy Buccio, coming to you from the Baptist Health South Florida studios in Coral Gables. The saying goes, you are what you eat. And it's true that everyone can benefit from eating healthy, from controlling your weight to preventing chronic diseases like heart disease and even diabetes. But what if you're one of the 23 million people in the US who live in what's called a food desert, where nutritious foods are virtually inaccessible? Well, joining us today to talk about this very topic and what she's doing to help people who are living in food deserts obtain nutritional food is Asha Walker, Executive Director of Health in the Hood, a nonprofit organization that focuses on bringing wellness to the community. Welcome, Asha. Thank you so much for being on the Health Channel.
Thank you for having me.
I am so excited to talk about this passion project of yours. But before we do this, you organized this. So tell us about yourself and what prompted you to start an organization like this.
Well, I describe